This presentation will look at anger and violence. In particular, a focus will be on the effect of anger on violence and how this issue can be managed. According to the Australian Psychological Society, anger is a normal emotion that can range from a mild irritation to a full-on rage. This emotion is often associated with various physiological effects, such as an increased heart rate, increased blood pressure, and higher concentrations of stress hormones such as cortisol. Angry behaviours can include yelling, throwing things, and even violence. So what is violence? Violence can be described as any action intended to cause harm. This can involve physical, emotional, or verbal actions. Violent behavior can be directed at oneself, another person, or a group of people. Such behaviors can include punching, kicking, hitting, insults, and many more. So how does anger affect violent behavior? According to the cognitive content-specific model, violent behavior is a simple way to express and thus reduce anger. A study conducted in 2000 found that violent individuals have a decreased blood flow to the prefrontal cortex. Given that the prefrontal cortex is used for executive functioning, such as decision-making, this suggests that anger may affect individuals' likelihood to be violent. Furthermore, a study was conducted where cortisol was taken orally. The results suggest that cortisol may be linked with increased levels of violence and aggressive behavior. It is clear that anger has an effect on the likelihood of violence, but how can we address this issue? CBT may be useful in helping individuals to identify realistic and unrealistic thoughts and beliefs that may trigger an angry reaction. There is evidence to suggest that CBT is helpful in reducing aggression and hostility. Mindfulness can also be used to address anger in order to reduce violence and aggression. According to Borders, Earlywire, and Georgia, mindfulness may be useful in treating aggression through decreasing ruminations. Progressive muscle relaxation is a method of stress reduction in which certain muscles are intentionally tensed and then relaxed. There is much evidence to suggest that this method may be useful in reducing anger symptoms.